Hello and welcome to the HealthMe Asia podcast. I'm John Linebauch and I'm your host. As the name of the podcast implies, we'll be looking at some unique and interesting healthcare services available in Asia and showcase their quality and their value. This exciting episode will be about mental health and specifically about emotional trauma and a holistic approach to learning how people can heal from the traumatic experience or experiences they have had. Mental health, which can often lead to and is often associated with substance abuse, has become an increasingly concerning problem for many people worldwide, especially since the COVID pandemic. According to some sources, such as the World Health Organization, 44% of adults surveyed worldwide in 2023 say mental health is the biggest health problem facing people in their country, not cancer and not heart disease. It is also estimated that almost 1 billion people globally suffer from mental health issues or a substance abuse disorder. Southeast Asia has long been known as a place to seek help with mental health problems and substance abuse, and there have been and still are many of these treatment facilities around. One particular treatment center, New Paradigm Holistic Trauma and Depression Retreat in Chiang Mai, Thailand, employs some innovative methods and effective strategies that are personally tailored. Here on the show as our guest today is the founder and director of New Paradigm Holistic Trauma Retreat, Dirk Lambert. Greetings, Dirk, and welcome to the HealthMe Asia podcast. I hope you're doing well.
I'm doing great, John. Thank you for having me.
So, can you tell us a little bit about yourself and your qualifications and how you got to where you are now?
Well, John, my name is Dirk Lambert. I'm 59 years old, and I was born in Belgium. I moved to Asia about 31 years ago, and I've been running mental health treatment facilities for the last 24 years. My qualification, my highest qualification is actually certified clinical trauma specialist from the Arizona Trauma Institute in the USA, and I have a couple of other certifications in CBT, Master NLP, and EMDR also.
Can you tell us a little bit about New Paradigm Holistic Trauma Treatment Center and what it offers and does?
It's a broad range, all-encompassing treatment program that has yoga, meditation, martial arts, ice bath, swimming, sauna, all these different aspects of the program, including 1 hour one-on-one psychotherapy session for every individual 6 days a week. So it's a very total program that addresses all different issues, all different requirements for the people suffering from trauma and depression.
What are some of the things that you don't do? What are the things that your treatment center is not?
Well, that's a good question, John. We don't take people that suffer from dependencies. So alcohol, pharmaceuticals, and narcotic dependencies, we steer away from treatment of these people. It's not our specialty or our goal at the moment, and trauma and depression is complicated enough. And I personally believe that people that suffer from dependencies and addictions should have treatment for that specific issue prior to trauma treatment. The highest priority is to overcome the addiction, or at least the active addiction. So we don't take people that suffer from addiction, and we don't do people that have been diagnosed with a specific psychiatric condition, such as schizophrenia or paranoia or...
What are some of the main alternative holistic therapies that you use?
We use mainly CBT, which is cognitive behavioral therapy, which is a very specific, objective-oriented therapy. It's opposed to the conventional talk therapy where people just talk about their issues and there is no clear objective as in how to go about it and how to change the condition or the situation that they're dealing with. So CBT is very practical and very goal-oriented.
So can you tell a little bit more about what did CBT entail doing? Can you get a little more deep on, as an example?
With CBT, we identify 8 specific domains about the individual. That includes the physical, the emotional, the nutritional, the spiritual, relational, professional. So all these domains are individually analyzed, and evaluated, and we look at what is going on in each specific domain, where they are specifically, and what needs to be done to take them to the next level. Yes.
Do you have some examples of some success stories using this approach?
I would say that 95% of the people that go through the program have a serious improvement in the quality of life, in their overall quality of life, not only the physical, but also the emotional stability and level of happiness.
So with your holistic approach to dealing with trauma and CBT, and I know we're going to talk about some other methods and tools you use, the idea is not to erase a traumatic memory, is it? Mm-hmm. Or to learn to accept it, or, how would you characterize that?
It's more about giving the people the tools how to cope with the traumatic experience they went through, and how to have the ability not to have that affect them on a daily basis. So there's many different techniques, including EMDR, that can help to reduce anxiety and reduce all the symptoms from trauma, from PTSD.
How does nutrition play into mental health, and how do you address it in your program?
Well, there's the famous saying, you are what you eat.
Good
so
point.
That is self-explanatory.
Yeah.
It's very important that people have good quality food. And we have specific nutritional plans. One of them is an 1821 live food diet that we offer. And we try to avoid all highly processed food, deep frozen, deep fried.
Yeah.
So we talk about live food, which is food with a very short shelf life.
What about things like coffee, caffeine, and those other things that we all kind of depend on to get us our day started, and those kind of
you said
relying the nutrition we rely on is fast food,
right?
For example.
As soon as there is an element of dependency, we're already creating issues.
There you go.
So I don't have anything specifically against any substance or any food, but as soon as there is an element of dependency, if you need it on a regular basis, then of course you have a potential backlash from that.
Right.
So we don't do coffee in the program. We do some teas, but no coffee. But on the other hand, we allow people on the day off to have a coffee, for example, on Sundays. So it's not that we say no coffee. It's just trying to have them regulate.
What about, there's a lot of vegan interests, and do you accommodate that, or do you account for it, and how do you...
We accommodate for all different types of food requirements, including vegan, including halal, and many others, depending on the people and their preferences or their requirements.
How about mindfulness and meditation? I think that's a big part of your program. How did that work, or how does that benefit somebody who's struggling with anxiety and depression?
Mindfulness is probably one of the biggest elements in the treatment program. It's important for people to teach them the ability to deal with compulsive thinking and excessive worrying. And what happens if we teach them meditation and we tell them to sit still and by themselves, usually they have adverse effects. So the more you try to be calm, the more the mind will start playing up and start to be more and more compulsive. So we have different ways to deal with that. We use the concept of dynamic meditation, where we use making noise, making sound, chanting, so the people are actually busy through guided meditation, rather than to just sit by themselves trying to calm their mind, which usually has the adverse effect of it. So,
a moment ago you talked about CBT and EMDR. How do those complement, traditional or hospital-based psychotherapy treatments?
Yeah, I truly believe they're very complementary to each other. So both conventional medicine and conventional psychotherapy is very complementary to the things that we do. They could perfectly work hand in hand.
So it's not a matter of the holistic approach is a better, right?
Sure not. Yeah. Definitely not. I think there is a time and a place for conventional therapy and conventional medical care and pharmacology also. And then as people get better, little by little, better over the initial shock of trauma, then we can start applying more holistic therapies.
Earlier you mentioned establishing domains of different aspects of a person's life to analyze and evaluate. You know, how do you incorporate your, your approach, to tailor that treatment for each person?
Well, obviously everything is tailored to every single individual. So we sit down with every individual and we look at their lifestyle, we look at what's going on with them, where they come from, what their intention is, and how to have a clear idea how to get there. So this type of planning and organization, lifestyle planning, is very, very important to do it very detailed and to have the ability to then take that into practice during the time they stay with us. And even more important, have the ability to take that home and have a continuation of the program, of all the things that we taught them at the program, so they can basically continue doing that in their real life. That is essential and a key factor of success of the program or failure.
One time before we were talking about that aspect of your program and people who typically don't get sort of a positive outcome. Mm-hmm. And you mentioned that oftentimes those patients or clients come because it's not really what they are wanting to do. They're not seeking it themselves. They're being pressured either by family or a boss or something like that. Yeah. Can you talk about that a little bit?
Well, obviously it's very important that the people are willing to participate in the program and that they are completely dedicated to it and that they come with full optimism and full commitment. And sometimes we see people that have been coached into joining the program by parents, by spouses, or by other friends or family. And when the people are not ready to participate in the program, and then obviously we can't expect the results that we want on both sides, you know.
I guess it's similar to the addiction. What is the philosophy of the 12-step process and accepting and admitting that there's a problem, and that goes further into getting treated and having success with it. Is that correct?
100%. There is a lot of similarities between addiction actually and trauma in terms of recovery. The people also have to have a high level of acceptance of their condition and the willingness to take full responsibility for their behavior and the willingness to make the changes themselves, and also to stop blaming others for the situation that they are in, for the trauma that's been caused to them. Often there is a high level of resentment and anger and resistance in relation to the people that caused the trauma. And as long as that is still present, then it's very difficult for these people to heal themselves.
Because they need to open up and admit some things, I guess, right?
They need to admit the situation that they are in, and ideally they need to stop blaming others, third parties, for what happened to them, which is not always very obvious to do that. And then at the tail end of the whole process, ideally there should be a moment where they can actually forgive the person that has wronged them.
So I guess you see a lot of people who do show up and they either project it to some other reason of why they have depression or anxiety or whatever, and are they trying to hide that, and do you get through to that often, or do you?
Yeah, I think it's a normal human reaction of people to blame others for what happened to them. It's our responsibility to give them the insight that there is other ways and better ways to deal with that are essential to full recovery. We're very selective on the people that we take into the program.
Oh, good point. Can you tell me about that?
Yeah, there is we call it a whole boarding procedure, which requires people to disclose all their conditions, all their medical conditions, all the medications they've been taking, medical history. We do an emotional evaluation prior And then there is at least 2 interviews, video interviews, to make sure that the people are really ready and that we are on the same...
That's a good way to say it.
Yeah,
ready.
That we're on the same page in terms of what they expect to receive from the program and what we can offer them, you know.
So what would be some of the misconceptions then, in your experience, about holistic approaches to mental health issues versus, well, just about, you know, the misconceptions of holistic approaches to trauma?
I think in general, the biggest misconception is that people believe that there is that they are sick and that they then can be healed, if that
Almost
makes sense.
like a magic pill.
Like a magic pill,
Yeah.
or something, a procedure that will revert their situation. That does not happen in reality. The only thing that we can promise that there is an improvement of the condition that they have, that the symptoms diminish in frequency and in intensity over time. So it's a progressive curve, and there is no such thing as I'm cured.
Right.
As I don't believe there is anything as I'm really sick, even if you suffer from all the symptoms.
So could it be fair to say that I guess a traumatic event could be very instantaneous, but the results of that usually manifest over a certain period of time, that you end up, you know, I want to say an evolution to it, but almost to reverse that takes a similar evolution, if you will. Is that
again very variable from person to person, and there is many different variations on trauma exposure. Some people can have one singular traumatic event that happened to them, attempted rape or some violence or car accident or something of that nature. But other types of trauma are people that have been exposed to abuse for extended periods of time, sometimes decades. And that can be child abuse, can be spousal abuse, and that is a completely different dynamic than when people have been living in this type of exposure for long periods of time. Obviously, it is more complicated and more difficult and takes more time for people to recover from that.
So that's a good point, because in the American landscape, and certainly recently in the last decade or two with our global war on terrorism, we tend to associate PTSD with combat traumatic experiences, but it's not, right? It's much broader or being applied in a much more...
PTSD can be the result of any type of traumatic experience. And not only the actual traumatic experience itself, I rather would say the perception of that experience. And a good example is for a family of children that have been exposed to some abuse, that one or two of the siblings suffer from PTSD and the other ones don't. And for the ones that don't understand why the other ones have it, and the other way around. So we believe that this has to do with some kind of a predisposition of a high emotional sensitivity of the person by birth. That some people are more prone to trauma or the effects of trauma than other people. It's the same thing in the military. There's people in the same squadron where one or two have extreme PTSD and the other ones don't have any symptoms at all.
Back to your program, can you describe a little bit of the overall program, like the structure and some of the things that you do during the 2-week, is that correct?
3 weeks,
3-week stay.
21 days. So it's a very regimental and mandatory program. We wake up very early for most people, not for myself. We wake up at 5 a.m. in the morning, and then we go for a 45, 50-minute morning walk into the rising sun, as we call it. And that is followed by swimming and sauna and ice bath sessions. Afterwards, we do a 45-minute meditation, and then we go off for breakfast, and then basically that's the beginning of the day then after breakfast. So
there's already a lot done.
A lot is done before we have breakfast. After breakfast, there is an hour of yoga, an hour of martial arts, an hour of massage, and an hour of one-on-one counseling. And then people have a little bit of free time in between to do some journaling or work on some tasks that we give them. In the evening, we have a dinner, a silent dinner, so all the other meals are silent also. And after dinner, there is a 1-hour workshop on topic of trauma and depression recovery. All these different issues are discussed then. And then after the workshop, about 7:30, there is another 30-minute, 40-minute meditation. And then basically by that time, everybody's really tired and ready for bed.
You know, again, where in there do you spend time with that individual? Isn't there a sort of a time each day that you meet one-on-one?
Yes, every day there is a 1-hour, one-on-one therapy session, private therapy session. And that is 6 days a week. We don't do group therapy sessions because personally I don't really believe in the concept, because people come from different nationalities, different backgrounds, and have different traumas and are already carrying so much when they arrive. For them to start sharing that with others and unloading on others and other people, taking other people's trauma on themselves is not a very productive way of doing things.
Yeah, the time spent needs to be focused on that person's issue
100%,
to reflect and to learn.
Which is contradictory to other programs where they have different views, where they believe that sharing your trauma with others can be beneficial. I believe there is a time and place to do so, but it has to be very, very specific. There has to be a bunch of requirements where people have actually experienced the same trauma. So to put, let's say, victims from an air crash survivors or something, or military people, put them together, or people that have been exposed to sexual violence, but not to have people from different traumas mixed into the same group. I don't think that's beneficial.
Well, I could guess that it would certainly require more time for them to sort of separate that, you know, as they're there to get treatment with you, and now they're listening to another friend, and then they're like, oh, that's worse than me, or
yes,
that's not as bad as me.
It becomes almost a competition
right.
of who has the worst trauma, and people feed off each other, and there's a whole potential dynamic that you can create, and then that starts living its own little life. But we are very aware of that, so we discourage communication between clients also during the day.
While they're on
we
site.
discourage socializing between them. So everybody's really confronted with their own challenges. Of course, we have all the support team that can talk to them, and there's always somebody that they can rely on or they can share something with if they need to.
Right.
But to do that with another person that is also in treatment is again not the right way to do
sense.
things. Again, in my personal opinion.
Well, that's good to point out.
Right.
So, but during the course of the day, I mean, you go on walks. People are going to talk. Is that true? Or?
Well, it's highly supervised.
Okay.
And people sign a disclaimer when they enter the program that they will not talk to other people.
Okay, interesting. Yeah.
Yes, we had to do this because people are people, and people just can't help themselves.
Right.
And they have the compulsion, especially when they feel that there's other people around them that are in a similar situation as themselves. There is this compulsion to share. And then we always have to step in and just tell them, hey, this is not the moment to do that.
That's an interesting...
Especially in the early days of arrival.
So then, you know, another thing that I think is that, you know, what's your view on having their mobile phones and those kind of things?
Well, no such thing. All forms of electronic devices and communication is not allowed. So on arrival, we take all their communication devices. Even literature that they have is screened to make sure that they really stay between the guidelines of what the program dictates. It's not easy, but it's very effective.
That's what I was going to say, that is probably one of the reasons that it is so effective.
100%.
Yeah.
So imagine now a different scenario where people are sitting around the same table with their phones, with a cup of coffee, and everybody's sharing their trauma, unsupervised. It has
a summer fun camp.
Not at all, but it has a severe negative impact on their recovery, definitely.
So then what advice would you give somebody listening that may say, hey, I'm interested in and but I'm a little hesitant. Is there some thoughts you have on that? Because you're kind of describing a little bit of a environment that people may not embrace off of what you're saying. Like, oh, it sounds like I'm super restricted.
It is very restricted, and nobody comes for fun. Nobody really comes super excited, or they are willing, obviously, which is the first requirement, to come, but nobody's jumping up and down to join the program. The one thing that determines their motivation is they have been suffering for so long without significant improvement, and they are tired of being sick and tired, and that finally drives them to the point where they go, okay, I have to do something about it.
They'll do whatever they need to do.
I do whatever is required, and I give up my phone, and I give up my coffee, and I give up everything else, not really willingly, but out of necessity.
Could you explain what EMDR therapy involves and how it helps process traumatic events?
Well, EMDR is a very interesting concept. EMDR stands for eye movement reprocessing desensitization. And it's a treatment process where, under supervision of a practitioner, the client or the patient is guided through a series of specific eye movements, and in the meantime recalling traumatic events. The objective of EMDR treatment is to have the ability to disconnect the emotional binding to the specific visual memory of the experience. Science doesn't completely understand how it all works, but we know that it does work, and that it's very, very effective and very, very quick.
How do you determine if a client is suitable for EMDR?
We believe that almost everybody could be suitable for EMDR treatment. Trauma, OCD, and phobias are also other issues that could be resolved with EMDR.
How about some examples? Can you share some examples of where EMDR has had, like significant or profound impact on their PTSD symptoms?
Well, actually, EMDR has had, without any exception, for everybody that we have treated, significant improvement of the symptoms of trauma. So it's a very, as I mentioned before, it's a very effective, very quick way to have instant relief, or at least partial relief from the symptoms of PTSD. What happens is there is no more emotional binding when people recall a specific traumatic event, where before, every time they thought of it or something triggered them into thinking about it, or there was some kind of an emotional experience that made them relate to the trauma, this is now all basically gone. So they can remember the event very clearly, but there is no emotional binding anymore to that specific memory, which is kind of a miraculous thing.
So it's not reliving it each time, or is it better to say it's when you relive it, it's got a different effect on your emotion?
It has no more effect, or very limited effect, on your emotion. And that is the interesting part, and also the crazy part of it. And for some people, very, very difficult, because it's so instant that this happens. So people have been suffering from nightmares, suffering from all these different symptoms of flashbacks. So now they can just, if they think about the event, they can think about it and don't get the emotional reaction thinking about it.
So then what are some of the differences in, traditional talk therapy versus EMDR?
Well, with talk therapy, there is this, I personally believe that this is a false perception of relief. When you talk about your traumas, then you feel kind of relieved afterwards. But this feeling of relief is very, very short-lived. And at the end of the day, nothing really changes.
So have you experienced then some patients that have, a resistance to EMDR therapy, and how do you deal with that?
I think everybody has a little bit of resistance against recovery. And a lot of people have very strong associations with their victim personality. And for them to give that up, it also requires a certain level of consciousness and willingness and preparedness to do that. So they have to emotionally already start to detach themselves from that image of a victim and start thinking about who it is that they want to become in the future. That is a critical part of recovery also. Because if the association stays consciously and subconsciously, as in I am the victim of this or that event, then of course it will hinder recovery. If you say, okay, the idea is basically for them to disassociate with the victim persona, very, very important.
Is there any safety concerns, or people have some sort of reaction in receiving EMDR therapy?
Well, everything is done in a very controlled environment, and the people have to feel very comfortable when they undergo, at least initially when they undergo the treatment, and have to have a lot of confidence in the practitioner that assists them. I think that's very important. The personal relationship with the client-practitioner relationship is very important. People have shown very emotional and even visceral reactions to EMDR therapy during the therapy in terms of,
Is that partly because of the sort of almost instant, I don't want to say result, but experience?
The result is not as instant. The result is more gradual. It takes probably about 24, 36 hours for that total process to do its thing. So it's not as in instant, as in if they walk away. It's very demanding, emotionally draining. And people are very, very tired and very kind of worn after a treatment. So they need to relax, they need to lay down. And then usually the evening after treatment, they have very vivid dreams and sometimes some very weird memory recollections from their childhood. And these are all parts of the whole process of EMDR.
What advice would you give to a therapist or a clinician who's thinking of incorporating EMDR into their treatment or into their practice?
I believe it is the go-to method now, and also recommended and highly advised by the WHO. The go-to PTSD treatment is EMDR.
So this is a good time to segue into collaboration. What's your view on the direction your practice is going, or the profession is going, towards incorporating holistic treatments with traditional hospital-based treatment?
I personally feel that everybody kind of sits in their own camp and believes that they can resolve the issues. I believe that conventional medicine and conventional psychology and psychiatry, they believe they have all the answers. And a lot of holistic alternative healers and practitioners believe that they have all the answers. My personal belief is that we are all very, very complementary to each other, and we should. And there is a time and place for everybody to step in and contribute to their part and their expertise and helping resolve a certain part of the healing process. And you know, I work on a regular basis, on a daily basis, with medical doctors, with psychologists and psychiatrists that temporarily hand over their patients to me, and I hand them back over to them after the treatment, and they continue, if necessary, treatment with them, or a requirement for a coach, a health coach, or a mental health coach, or a nutritionist, also very important. So all these different categories are all very important if we want to cover all bases. We have to really cover all the aspects. And not one person or one individual or one methodology has the ability to cover all.
So can you give some examples of, a patient that in this situation they need, more hospital-based psychiatric care,
Yes.
maybe suicide,
Yes.
versus somebody who would come for holistic trauma treatment?
Well, everything depends on the emotional load that the person is exposed to in that moment in time. Some people are absolutely not ready to participate in our program, and they need to stay under psychiatric care, sometimes inpatient psychiatric care for extended period of time. Could be weeks, could be months, until they are then dismissed out of psychiatric care and then go home for a while. And then, it's a long process. The whole recovery process is a long process. But eventually, psychiatry does not incorporate physical activity, nutrition, spiritual practice, breathing exercises, and all these other things that we bring to the table. So again, everybody's complementary or should be complementary to each other, ideally.
Earlier you mentioned this sort of A to Z kind of approach.
Yes.
And that's what you're trying to describe as a comprehensive view of the patient's traumatic experience and what tools are best at any particular moment.
Exactly.
Okay.
So when people have recently experienced trauma, it would not be suitable for them to undergo a treatment at our place. So then there would be a requirement for pharmacology for a period of time to deal with the immediate aftermath of trauma. So most of the patients that we see or the people that we see in our program have been suffering from trauma and depression for an extended period of time, which is many, many years, minimum 5 to 25 years. So we never see anybody that just recently has been exposed to trauma or recently has fallen into depression and then comes to us for treatment. They usually go through the normal pathway of conventional medicine, conventional psychiatry, conventional psychology, pharmacology, and then get the benefits to some extent that they can provide to them, and then still get either stuck or still want to get more out of it, or are not satisfied with the quality of their life and still want to get better, but are unable to get better with what is currently then available for them. So they're searching for alternative means to improve their life.
It's an interesting way to characterize the space or the time, and that you have to sometimes discover with them back in order to find what maybe not the trigger or that specific event. Mm-hmm. Is that correct?
People think about trauma often that it is a singular event, but in my practice, I rarely see people with singular trauma exposure. Most of the people is multiple exposure over extended period of time, many, many years, decades sometimes. So it starts usually as a young child abuse, sexual abuse, then continues with spousal abuse or relational abuse. And it's just this ongoing, continuous process of exposure over many, many years.
And so all of the things that they have built or relied on for coping, workable or not, are things that you have to help them identify and change. Yes.
Yes, but that's also an interesting thing, is that people are so emotionally exposed and have so much emotional pain that they are seeking for coping mechanisms, and usually the things that are most readily available within their environment, which is alcohol, is very common, and then narcotics or pharmaceuticals. And then there is always a history of drug and alcohol abuse, most of the time, either prescribed or non-prescribed. Then there is eating disorders, body self-harming. There's many other coping mechanisms.
Extreme, many things.
Many things could be
risk-taking.
Risk-taking, fitness, sex, relationships, shopping, name it. Many, many different ways for people to try to ease or deal with their emotional pain. At the end of the line, when all of these things, which are all great and work well for a very certain defined period of time, at some point they don't work anymore. Then they need to change to something else. Eventually, they end up that nothing is working anymore. The pharmaceuticals don't work, the alcohol doesn't work, and none do any of the others. So they come basically at the end of the road, or rock bottom, as we call that. And then they usually turn up at our place.
Would you say then that you don't see too many young people, or is that an element that plays into when they would actually be fit or appropriate to enter your program?
Well, one would say that, but unfortunately, especially in recent years, I see more and more younger and younger people, which is good and also kind of concerning on the other side. But the good thing is that people, I see a lot of people in their early 20s, so they already came to the realization that they don't want to continue the drugs or the alcohol or pharmaceuticals, or just also because of what is going on with the recognition of mental health recently and the awareness campaigns around it that has brought it so much more up in the open and much more approachable for people. Also for a lot, we see much more males into the program recently. Before it was only females for many years. We would do 90% females. Now it's 50-50. So more and more men feel that they can, that there is the right time and the right place for them to come out and express their challenges on mental health.
Another thing that I thought of when you said that was in addressing it early on in their life, that usually will give them a longer period of their life where they're free of these huge traumatic health issues.
Fantastic. These things actually ideally should be taught in school, in high school. There should be classes in mental health, because at the end of the day, if these people would have been introduced to alternative ways of dealing with their emotional pain, that meditation and yoga and CBT, NLP and EMDR, that all these things could help them as alcohol can to some extent, of course very limited and with very high risk and very high consequences, then of course it would be an easy choice for them to choose for the things that work better and have no side effects.
What role do you see technology playing in helping bridge the gap between conventional methods and holistic medicine or holistic approach?
Yeah, I'm a strong believer in technology, especially in the way the technology has developed over the recent years in terms of having measuring equipment in the body to have the ability to measure sleep phases and all that. I think is very, very important to measure not only emotional load on the physical and emotional body, but also to measure progress in recovery. I also believe is very, very important, which is not something that is very well done in conventional psychology. We measure progress and emotional state every week, and it's a series of 114 questions, yes or no.
Every week.
Every week. And then you have a number that indicates current emotional load and in reference to the previous one, progress or stagnation. And these things are very important for us to know where we are, what's going on.
So, technology or exploring frequency, and not just in sound, but also vibrations. Yes. And those kind of technologies. Can you talk a little bit about that?
Tesla talked about, if you want to know the universe, think in terms of frequency, matter vibrating at a certain frequency. So I do believe there is a lot to be discovered still. We use a lot of sound and we use a lot of frequency in our meditation and in certain parts of the treatment. And it has a very, very calming effect on the people. And it helps, it gives you instant relief with issues like anxiety. So yes, very important and very effective also.
So what is the goal, the end state of the program? It's to help develop self-reliance as coping tools, or is it to reduce dependency on pharmaceuticals, for example?
Well, my goal is very simple. It's to basically have my clients rid themselves of the trauma and depression and increase their quality of life on all levels. And obviously that goes with no dependencies on narcotics or specifically pharmaceuticals. Yeah. So that is the real goal. People can have a happier life, a more stable life, a more fulfilling life than what they used to have. That is the ultimate goal. But it's a long process and it's an educational experience for the people that go through the program at our place, and their program really starts the day they leave and take everything what they have learned into their daily life, into their new life or their real life, That is a different chapter then. We can only teach them and guide them so much to the point where they have to stand on their own legs and do it themselves.
So I know somebody who has gone through your program and have seen firsthand the dramatic or significant improvement as a result of, your treatment. So I can attest to the efficacy and that it is a very good program to go through. You will notice the results. So
thank you for that, John. It is a life-changing program for the people that are really committed to it and really make the effort of doing what is required. We can only do so much in trying to guide the way, but they still have to do the walking.
So what advice and suggestions could you give to people who are considering, they've seen the show and they learn about it, so to help themselves if they feel like they have an issue?
Well, there's two very important components. One would be nutrition and sleep hygiene. I see people not eating healthy enough and not sleeping enough time, and the quality of their sleep is also compromised. So these are two things that somebody can change in their daily life and have immediate positive response to their quality of mental health. And obviously also physical exercise, very, very important. So three things: physical exercise, sleep hygiene, and nutrition.
Those would be things my mom would say as a kid, right?
Go to bed, eat your peas.
Yeah. How can somebody find out more?
Well, we are obviously on the World Wide Web, www.newparadigm.org, and you can find my recently published book. It's called Stand Alone. It's a guideline for holistic treatment of abuse, trauma, and depression, and it's available on Amazon.
Thank you very much for being on the podcast, Dirk, and it's been a pleasure to have you here. Great information, and I hope that we can do another episode soon. So thank you.
Thank you, John. The pleasure was all mine. Thank you for having me.